This is a presentation of public domain material that deals with the complex subject of autism spectrum disorder comorbidity. It offers supporting material that is informative and contemporary and presents treatment options that may benefit parents seeking to influence professional support for their ASD child, adolescent or youth. ASD is often accompanied by comorbid psychiatric disorders such as anxiety and depression, which can manifest themselves as conditions over and above ASD symptomatology, and which may require careful screening, diagnosis and treatment. In a person with ASD, these comorbid disorders may often go untreated, as the emphasis is on treating the core ASD challenges using established evidence-based practices, for example such as found in the Science of Applied Behavior Analysis, ABA. However, of particular interest among specialists dealing with ASD comorbidity, is the technique of cognitive behavioral therapy, CBT, to combat common comorbid disorders such as anxiety.
Prevalence rates of anxiety co-occurring with ASD, such as general anxiety disorder and social anxiety disorder, have been recorded and publicized in the research literature to run as high as 55%. Knowing this high frequency of occurrence prior to any significant symptoms presenting themselves, can be beneficial to parents, so as to elicit early screening, diagnosis and treatment, and can explain challenges that manifest themselves in peer-peer or multiple-person environments, such as school and sport club settings.
A good educational overview of the wide range of neurodevelopmental comorbid psychiatric disorders such as anxiety, depression, ADHD, tics etc. is available on the Autism Community Training website, www.actcommunity.ca. Look for the video contribution from Dr. Dua. This material is recommended viewing, and the reader should be prepared to review this more than once. Both from family experience and research literature studies, the compounding of ASD challenges with identifiable comorbid disorders, such as anxiety, can and do introduce additional challenging behaviors of a physically aggressive nature, which is often directed to caregivers such as parents and interventionists.
Challenging environments. One of the core features of ASD, namely social skill deficiencies, can easily both compound and exacerbate anxiety symptoms, particularly in challenging settings such as a school classroom or playground. They often expand as additional demands are placed on the ASD child as they attempt to progress from elementary to high school. Techniques identified and discussed later in this presentation and geared to possibly alleviating challenging behaviors are therefore geared towards the adolescent and youth population. See Dr. Dua's video presentations discussing the chronological aspect of comorbid psychiatric disorders such as anxiety in ASD adolescents and youth to better understand this common development.
Anxiety prevalence rates. An appreciation of comorbid anxiety rates is beneficial to better understand why this comorbidity is important, particularly in terms of developing parental influence to elicit support from mental health professionals. For those parents who wish to better understand this condition, data from authoritative research-driven studies are readily available. For example, a 2006 study indicated rates of anxiety disorder as high as 55%, with a similar 40% finding from a 2008 study, and a recent 2015 study that determined rates for comorbid clinical social anxiety disorder as high as 50%. If the reader is reticent to read this type of material, then the EN Research audio-video presentation from the next slide may be a better initial educational choice.
The Interactive Autism Network provides an easy-to-follow webinar called Meltdowns and Aggression in Children with Autism, which is recommended viewing. The video plays within the slideshow if you are using the downloaded PowerPoint presentation. Along with aggression occurrence rates, the webinar includes material dealing with risk factors and how these affect intervention choices. This aggression aspect can be a difficult subject to tackle for any parent or caregiver, and this material helps to open up parental understanding prior to seeking support from suitably qualified professionals.
The reference to the research paper, Anxiety in Children and Adolescents with Autism Spectrum Disorders, is included as the reader may, after viewing the webinar from slide 6, wish to read this important article. If anything, it will help to solidify the use of appropriate terminology when discussing the subject with other parents and qualified professionals.
Social anxiety is a diagnosable condition that ASD children can and do experience. The UCLA-driven PEERS program for the enrichment and education of relational skills, developed for high-functioning ASD children, adolescents, youths and adults, references research studies that give significant social anxiety comorbidity rates between 17 and 22%. The research effort required to develop the PEERS evidence-based intervention, spread over 10+ years, illustrates the recognition of anxiety within its goal of developing ecological social skills to ASD students and adults.
Treatment options. Emotional and behavioral challenges often appear with ASD and anxiety combinations, and while there is a very limited empirically supported treatment data that specifically addresses ASD and comorbid anxiety, there are some promising developing techniques associated with psychotherapy. See PubMed document 19309326 or the complete reference on the slide. Traditional approaches have concentrated on the use of psychopharmacological intervention, but at the cost of problematic side effects. Both of these treatment modalities, psychotherapy and pharmacological, may be difficult to access except in highly concentrated human conurbations, and even then it may be difficult to find professionals who have experience in dealing with high-functioning ASD students.
Research papers 2. NIH public access material also includes this paper. See PubMed document 380-9000, full web address on the slide. This topic is one of a number associated with autism research that continues to gather pace, and the audience will easily find other recent studies on this PubMed database.
CBT reading material, published in 2013. This book covers the science of CBT when developed as an effective intervention for ASD children and adolescents. The book is suitable for parental reading, but as the subject matter is itself reasonably complex, the average parent may choose to look for material to provide an introduction to this science, rather than seek to understand its fuller complexity.
UCLA Peers Intervention, though not specifically aimed at treating comorbid anxiety, in particular social anxiety, the UCLA Peers Intervention has been observed to reduce some unwanted behaviors, for example those associated with frustration of isolation and difficulties in integrating with similar age peers, that can be present prior to intervention. Because the nature of the intervention is to improve the ability of the ASD participant to better integrate in natural settings with their peers, one could reasonably expect socially causing anxiety to reduce following the successful UCLA Peers program. It should be noted that the UCLA Peers program is a specific CBT-based intervention.
UC Davis Mind Lecture. This institute offers a wide range of neurological-based online videos that are contemporary and of a high professional standard. One of the 2015 summer lecture series presents the use of CBT for anxiety in children with neurodevelopmental disorders, such as ASD. The web link is included on the slide. The video is easy to watch and listen to, and besides dealing with the methodology and findings of a specific treatment program, introduces the ongoing development of diagnosing specific comorbid disorders during the observational and interview procedures normally found with ASD diagnosis.
Coping CAT. This manualized evidence-based program is designed to reduce anxiety in both young children and adolescents. The attraction of this program is that the facilitator does not require any specific minimum qualifications, and can readily learn the program for delivery using video and PC-based training materials. Furthermore, these materials are available not just in the USA, but also in Canada.
Coping CAT materials. Workbook Publishing provides USA-based online ordering for Coping CAT materials. Materials available include training videos, and workbooks for both facilitator and child, or adolescent, for use during the intervention.
Coping Cat additional resources are available from this Canadian reseller, www.cavershambooksellers.com. Useful materials to provide or recommend to any support team who are considering this type of evidence-based treatment include the Coping Cat DVD titled, Managing Anxiety in Youth.
CBT training, that helps to introduce the basics of this therapy, is available at the website ca.ctrinstitute.com, at a very competitive rate. The material is relatively easy for parents to follow, yet it is still from an authoritative source.
In summary, this presentation has attempted to provide parents with a fact-based and sound understanding of one of the common comorbid psychiatric disorders, namely anxiety, that often accompany a diagnosis of autism spectrum disorder. Whilst it is emphasized that only a trained, experienced professional, such as a child psychiatrist, can determine any comorbid disorders, and thereby recommend or provide treatment, it is always important that parents are knowledgeable about this type of condition. This helps to ensure they seek appropriate and timely intervention for their children, adolescent or youth.
Sources of prevalence rates of comorbid anxiety, research efforts to develop evidence-based intervention techniques, and examples of CBT programs, peers and Coping Cat, were described. CBT implementation resources for Coping Cat, and inexpensive introductory CBT basics were included. The online video-based education, such as Dr. Dua on autism community training, the Ian research, the UC Davis presentation by Brianna Winder-Patel and the Peers technique, are highly recommended. Enhancements to his video are forthcoming and will include the ability to select web pages and video material, for example, the UC Davis and ACT training videos, during the playback of this video.